Welcome everyone, and thank you for joining today's webinar, Hot Topics in Research Ethics. This is a webinar series sponsored by the MORE's program, the Master of Research Ethics Studies program, which is a collaboration of the University of Malaya and Johns Hopkins Berman Institute of Bioethics in the US, with support by the US National Institute of Health, Fogarty International Center. So this is part of a webinar series that we started earlier this year. As you can see on the slide here, had a number of speakers to date. Today we're joined by Phaik Yeong, who will be introduced shortly by my colleague Sharon Kaur at University of Malaya. And we have Tamara Liskate, who will be joining in April of this year for our fourth webinar. All of the webinars are archived on program website, as well as on the website of the Berman Institute of Bioethics. So as I mentioned, this program is co-hosted between Johns Hopkins Berman Institute of Bioethics and the University of Malaya in Kuala Lumpur, Malaysia, under the Masters of Health Research Ethics program. And we're currently underway with training of master's student cohorts at the University of Malaya. And if you're interested in that program, we'll post a link to the program website during the webinar for you to review. The program itself has an application deadline of around the 31st of May every year for intake of the cohort in September. It's a one-year full-time program. We offer up to 10 scholarships each year to individuals from low or middle-income countries in Southeast Asia specifically. And through the program, seek to develop graduates who are equipped to take on all the interesting challenges in research ethics that are, some of which have been longstanding, some are emerging now, and we'll be hearing about one of those issues today with our speaker. Just a few sort of housekeeping rules. Once you join the webinar, you have your audio and video is turned off automatically. We're asking everyone to please type any questions that you might have in the chat box, and we'll address them during the question and answer portion of the webinar. The session is currently being recorded, so just so you're aware of that as well. And looking forward to the webinar, which will be about 40 minutes or so presentation, followed by the discussion for an hour total. So with that, let me hand it over to my colleague, Sharon, who will introduce today's speaker. Sharon, over to you.
Thanks, Joe. And hi, everybody. Welcome to this webinar, and I'm really looking forward to this one. And it's my greatest pleasure and honor to introduce a dear friend and colleague, Professor Phaik Yeong. She's an associate professor at the University of Oxford, but she's based in Bangkok at the Mahidol Oxford Research Unit Tropical Health Network. She is the founder and current head of Bioethics and Engagement at MORU. And her areas of research are fascinating. She's interested in ethical issues arising in research with underserved populations, particularly how to ethically involve children, migrants, refugees, and other vulnerable groups in research. And for today, we'll be looking at her second area of research, which is how to promote fair and equitable sharing of individual level health research data between higher and lower income setting. And I think that this is proven to be a really busy time for Phaik Yeong, especially in relation to COVID-19. So Phaik Yeong, over to you.
Thank you. Thank you, Sharon. Thank you, Joe. All right, share screen. Okay. Okay, tell me if you can see this.
It looks great, yeah.
Okay, good. Hi. Hi, everyone. Thank you for having me. So as Sharon mentioned, my name is, well, in Malaysia, it's Phaik Yeong. Internationally, I'm Phaik Yeong Cheah. See, whichever is more glamorous. So I'm an associate professor at University of Oxford and head of Bioethics and Engagement at MORU. So before I start talking about data sharing, just a little bit about MORU. So MORU is a collaboration between University of Oxford as well as Mahidol University and funded by the Wellcome Trust. We've been around here, this collaboration has been around here for 40 years. Bangkok is our hub where I'm based, but we conduct clinical research internationally. There is a dedicated Bioethics and Engagement team, which I lead. And this slide here is a snapshot of some of the recent things we've done. So our research topics are tropical medicine and infectious diseases. Over half of our work, well, used to be, before COVID, used to be malaria. We have a lot of malaria studies in Southeast Asia and Africa. And we also work on antimicrobial resistance, TB, maternal and child health, and now COVID. So I just want to point out that we currently have two COVID studies, well, more than two, but two relatively large one. One that's recently completed is called SEPCOV. It's a social science study, and I led that one. And the other one is called COPCOV. COPCOV is a study using hydroxychloroquine and chloroquine for prevention of COVID. And the reason I mention this is that later on in the discussion, I will talk a little bit about how we're affected by data sharing or non-data sharing. Okay, so, oh, where am I? Okay, so I'll start by talking a little bit about the evolution of open research and data sharing, and then data sharing landscape before COVID, then after COVID, and also discuss some persistent challenges. Okay, so we've been increasingly moving towards arguments for sharing and collaboration in the scientific or research community. We have registered clinical trials on the website now for quite a few number of years now. We've also encouraged publication of negative results. So previously, negative results are not published, just hidden away. More and more protocols have been published, especially clinical trials. We have encouraged open access publications. So previously, many publications are hidden behind a paywall. So you have to subscribe to a journal, otherwise you won't get to see the paper. And then we also have post-publication review. So for example, in Welcome Open Research, I posted on the right here, on the slide here, you submit your paper and then it gets published after an editorial checks. And then reviewers review, and then you can submit a version 2 or version 3 and so forth. So it's not dependent upon the reviewers. And we've also been encouraging preprints like medRxiv as well. And then for today's talk, we are talking about sharing of individual level data and other outputs from research. So the key word here is individual level data that comes from research. So no, I'm not talking about aggregate data, we're talking about individual level data, or a bit anonymized. Okay, so these things have crept into some research guidelines as well. I just pull out one, it's the Declaration of Helsinki, which most of you know. Just note on Article 35, it says that every research study involving human subjects must be registered in a publicly accessible database. Note here that it is every research study, so clinical trials and non-clinical trials. Article 36, researchers have a duty to make publicly available the results of their study on human subjects. Inconclusive as well as positive results must be published or otherwise made publicly available. Okay, so before COVID, the landscape before COVID, there's, as I said, an increasing promoting of sharing of individual level health data. Why is this so? To improve transparency of research and in turn improving trust in the scientific enterprise. Maximizing the use of data already collected. So data collected has got a lot of investment of time and resources, maximizing its use. So and hopefully if we have more data combined from various sources, we have bigger, more powerful data sets, and we can answer more research questions. And the ultimate aim is to improve science and improve health for all, including those in low and middle income settings. Some people have said this is even more important in research in low income settings, because proportionally there's less research in low income settings, and therefore the data obtained is more precious, even more useful to share that data. And of course, in a pandemic situation, this data is very useful to be shared widely and also quickly, because we want to answer important research questions quickly. So, based on these ethical imperatives, many international research funders and journals require data to be shared with others outside the research team. It's not just within collaborators, but to share them more widely. Okay. But some skeptics have said, oh, what about, yeah, it's all well and good. But, what about group harms? Yes, you can de-identify and anonymize, but then group harms like stigma, you can't get rid of that even with anonymization. There are also potential breaches of confidentiality. So the more people have access to the individual level data, the more chances there are of identifying who that participant was, especially if they combine data sets with other data sets gained from other sources, phone data or other types of data. There is a real danger of misinterpretation of data or taking data out of context. And this is especially true because when you're not collecting data yourself, you don't understand the context of which the data is collected, and hence there is a chance of misinterpreting the data. And primary researchers, of course, they fear of losing out, all their blood, sweat, and tears of collecting the data, and sometimes years of their lives don't pay off because the data will be taken by secondary users who wait by their computers for people to share the data that they've collected. And then if you see on the right side, there's a paper that came out in Science. They asked, researchers in the global south have asked, well, who is benefiting from this data sharing? They say that it is mainly the people in the West in high income countries. So there's a real risk of exacerbating existing inequalities between high income settings and low income setting researchers. What this means is that data collected by LMIC researchers could get analyzed more quickly and more efficiently by high income researchers because they have more facilities, they have more resources, they're more experienced, and they can publish in better journals and therefore get better academic accolades. They compete for the same funding and get the funding. So there's a risk that the gap might widen. And then there's the everlasting consent issues. Those of you who work in research ethics knows that we can talk about consent forever and we still won't resolve it. So consent issues, let me elaborate a little bit about what I mean. So we know that consent issues are already difficult, even without data sharing. So with data sharing, there's even more complexities. If you look at international research guidelines, I'm just taking one example here, the SIOMS guidelines. It says that you need to have specific informed consent for a particular use for the data, or broad informed consent for unspecified future use. So broad consent for unspecified future use. A lot of researchers, ethics committees, and scholars agree that broad consent for future unspecified use is the way to go for data sharing. However, there are problems, of course. So consent for the primary study is challenging enough. So if you look at broad consent, you can ask loads of questions. What are the aspects of data sharing are considered most important to inform participants? How to explain data sharing to potential participants? Is broad consent even considered valid consent? As you know, consent consists of three things. You need to explain, provide information, enough information to the participants. So broad consent means, it'll be used, unspecified future use. Is that information? And the next one is, of course, understanding and voluntariness. So the information bit is questionable here and has been raised by many ethicists. So we ourselves have done some qualitative work in Thailand. We've interviewed some research participants, researchers, and community members. And we found that not many people fully grasp what we mean by data sharing. And mind you, this was done in Bangkok, not rural Thailand, and still participants find it quite difficult to grasp what we mean by data sharing for unspecified future use. Nevertheless, we have a lot of people around the world have worked out a way to handle this. One way is by governance, good governance of data sharing mechanisms. So we know consent is imperfect. We know that there are potential harms like exacerbating existing inequalities. So that's why governance here is quite important. To realize the benefits of data sharing, the ideals of data sharing while mitigating its risks. And many people have used the managed access route to control access. And for example, using a data access committee, a committee that looks at data requests and approves or disapproves data requests. So instead of completely open access, uploading your data set to the internet for everyone to use without restrictions, there's a review process by a data access committee. So this committee looks at who is applying, what will the data be used for, how will the primary investigators be credited, are there any potential group harms, is there any potential of breach of confidentiality? And after that review process, there's a data access agreement signed by both parties. For us, it'd be University of Oxford, and then signed with the party requesting the data. And we say that, okay, this data set, we've passed it to you, you're going to use it for this aim, and you are not going to use it to do other things. You're not going to reshare it with a third party without telling us. So that would be in the agreement. So many data access committees exist now. MORU, we have one, and I'm the coordinator of that committee. And I show here on this slide some that you may have heard of already. Okay, so here's a little bit about what the journals say. So we've heard about the potential benefits and harms of data sharing. And the international journal editors have also said that from 2018, if you submit a paper to an ICMJE journal, that's the Lancet, New England Journal, all the high impact journals, if your report contains results of a clinical trial, it must contain a data sharing statement, okay? And clinical trials begin enrolling participants on 1st January 2019 must include a data sharing plan. Note here that they do not say that you have to share data immediately or upload it or have it open access. You have to have a plan. They want to see the plan. They want to see your data availability statement because they know that there are potential harms, and people have complained because initially the ICJME want everyone to upload their data set together with the paper. Okay, so this is where we're at prior to COVID. And what about the landscape after COVID, AC? Okay, time here. Okay, we're good. All right. So as you can imagine, you know, things have to get. So there was a press release on the 1st of January 2020 signed by many funding organizations, researchers, as well as journals. This builds on previous public health emergency because there's an imperative for all parties to make any information available quickly that might have value in combating the crisis. So this press release came out in January. There are unsurprisingly stricter requirements. It says the first bullet point says that researchers should share interim and final research data relating to the outbreak with protocols and standards used to collect the data as rapidly and as widely as possible. So share interim and final research data, okay? And second one is that research findings are made available via preprint service before journal publication, and then with clear statements regarding availability of data. All right, and this is signed by a lot of journals, funders, and research groups, including the ICMJE journal group. And this is a fairly, fair statement, right? Okay, but despite that, data sharing is still not widely practiced. So we know the pharmaceutical companies, the vaccine companies, I think it's quite difficult for them to give you the data immediately. And we're not going to talk about that in today's seminar because there's a lot of things to talk about. But look at the amount of press releases and articles on in the media. They rely on researchers to report headlines of findings without really, sometimes without the publication, and most of the time without the data. Thirdly, journals are under pressure to publish high-profile papers. Every journal wants to publish the first vaccine trial, the first on COVID, the first trial that reports a drug that works in COVID. Okay, and I'm going to spend the next few minutes talking about this problem. Okay, right, I'll go right into it now. So I'm just going to spend a couple of minutes talking about this case here. If you look on the right, there's this paper that was retracted. Hydroxychloroquine or chloroquine with or without a macrolide for treatment of COVID-19, a multinational registry analysis. Okay. Actually, Sharon, can you tell me if you can still hear me?
Yes, I can hear you, Lauren.
Okay, good. I'm just thinking there was a webinar where the speaker finished the presentation and then they told him, oh, you were on mute the whole time. Okay, good. So on the 22nd of May, the Lancet published this observational study indicating that hospital patients with COVID-19 treated with hydroxychloroquine and chloroquine were at a greater risk of dying than patients not given the drugs. Within hours, many hydroxychloroquine and chloroquine studies were paused, including our study on COP-COV. COP-COV is a study by MORU using chloroquine and hydroxychloroquine for prevention of COVID. It's still ongoing, by the way. So a lot of the regulatory agencies stopped the study worldwide based on this paper. Within hours, so this came out on a Friday afternoon in the UK, which was quite early morning well, quite late on Friday in Bangkok. So as you can imagine, Saturday morning panic, all of us had an emergency meeting. So all of us looked at the paper really, really carefully. You know, we are a multidisciplinary team. We look at the paper very, very carefully. The statisticians, the ethicists, you know, the epidemiologists look at the paper very carefully. And we thought, we can't really understand it. We need to ask for the data. And we did. So we said, we wrote to Professor Mehra, and he said, our data sharing agreements with the various governments, countries, and hospitals do not allow us to share the data, unfortunately. So we were stuck. And of course, this paper has more issues than the data sharing issues. And wearing my ethicist hat, already picked out a few. For example, there are only 4 authors. It can't be right, for example. But we're not going to go into that because it will take too long. But in this particular case, no one saw the data because it was a fraudulent paper. It was said that the 3 out of the 4 investigators said they haven't seen the data, and neither did the journal, neither did the reviewer, but this paper was published. So this is just one example that affected a lot of our lives at MORU. If you're interested in it, have a look at this open letter that was written by, well, signed by more than 200 people, and coordinated by my colleague here, James Watson. Not that Watson. We have our own Watson. Okay, so that was that. And then I'm going to pick another one. Unfortunately, it's a Lancet paper. And this was a paper published, this was on the Russian vaccine study, Sputnik. And look at the data sharing statement. Proposals will be reviewed and approved by the sponsor security department, researcher and staff, based on scientific merit and absence of competing interests. I don't know about you, but I really smiled at this data sharing statement. I'll leave it at that. Okay, here's one that came out not that long ago, December 2020. If you know, WHO has a huge study called Solidarity. They are studying lots of drugs for treatment in COVID patients. So this is for treatment. So this paper came out saying that remdesivir, hydroxychloroquine, lopinavir, interferon had little or no effect on hospitalized patients with COVID. It was published on December 2020. Look on the right side of the slide, and this thing circled by in red. When will the data availability begin? It says when the final report is published. So if you look back at the trial registration, it says the primary completion date is March 2023. That's the primary completion date. So when the data is ready for sharing, it will be a bit later than that, or much later than that. So this is a WHO study, and we won't get the data to verify or to look at this paper until quite late. Okay. What I'm saying is, I think there's room for improvement. I'm not saying that we haven't made progress. We have made progress. The fact that the sequence of the COVID or the SARS-CoV-2 virus was out quite soon after the discovery is a good thing. The fact that there's a database for variants of COVID variants, international database for COVID variants is a good thing. But I think that's not enough. So there's low compliance to requirements for data sharing, despite that statement in January 2020. There's ongoing research on the level of compliance conducted by a group in India, in the George Institute. Preliminary results show that it's not that people are not that compliant to the various guidelines. And the reasons for not sharing are that publications are based on preliminary or interim data, as shown by, let's say, the WHO paper. And many researchers, maybe they don't know how to prepare their data sets for sharing. I mean, that's a legitimate concern because it's relatively new. You need to curate it. You need to have data management teams and skills to share the data. You need to have data management training. So it's not easy. If you're interested, there's a new data sharing course that's just come out. The link is there. And one thing I've shown too is that journals are probably not strict enough. So after the MERA paper got retracted, Lancet issued some new guidelines about data. And we won't go into detail about it, but have a look at what the new guidelines say. But all stakeholders are responsible to make this happen. Okay, I'm going to finish off with this slide. And this slide was, there are 5 bullet points here, and I must say this slide is an end result of various discussions I've had with colleagues who work on COVID, interested in COVID, who live and breathe COVID. So if data were more available, what would it mean for us? Firstly, if data from drug trials were more analyzed with greater granularity, its efficacy in mild and severe COVID. COVID is a spectrum. People get mild diseases, and in Thailand, there's a lot. Well, there's cases, but there are very few deaths. So mild diseases, very severe diseases. So we should. What they say is that we can't discount drugs based on a bunch of data sets that we can't actually see the details. And we know, on the second bullet point, we know vaccines are being rolled out like crazy now, right? And we know that the trials have been done only in a very specific group of people. And this is our chance to analyze real-world data on the effectiveness and safety of specific groups of people, like vulnerable groups, the elderly, and so on. Thirdly, excess mortality data is useful to measure direct and indirect impact of COVID-19. This will give us a better picture of how different people, different countries are faring. Why? Because different countries count deaths in different ways. So incidence data is not enough. Testing data is not enough, because of various levels of testing, various ways of counting COVID cases. But if we have mortality data pre-COVID and post-COVID, and we can see the gap, we will know better what the impact of COVID is. And let me give you an example here. So Peru has the most excess deaths per capita, whereas Belgium has the highest COVID death count per capita. So it's vastly different, right? We should have the data from both ends to compare and have a better picture of COVID and how to deal with it. Last but not least, sequence data, SARS-CoV sequence data. It will better, so these are variants. It will better provide us with real-time information about variants, the genetic diversity, the spread, evolution of the virus to assess the impact on current efforts to control the pandemic, including using vaccines. And this is, so as I said earlier, a lot of sequence data, they go into an international database, but this database is only populated by the UK, US, and Denmark, mainly by the UK. So of course, variants, this is quite a sensitive and political thing. People may not, countries may not have the capacity to sequence and may not want to reveal it in case you give it a country name, like the UK variant. Okay, so I'll leave it at that. And this is my final slide. Just to say that all these discussions have been had with various colleagues, including the Data Sharing Working Group of the COVID-19 Clinical Research Coalition. Have a look at our link here, and the Data Access Committee of MORU, which has seen lots of data requests. All right, Sharon, back to you. Thank you very much.
Thanks, Phaik Yeong. That was really interesting, and we have a number of questions for you. Joe, would you like to start the question answer session?
Yeah, sure. Thanks, Phaik Yeong. That was really, really interesting and obviously very timely. So I think as you are well aware, data is sort of often referred to as sort of the new currency, and there's a lot of sort of commodification of data that's occurring in various places. And I think and at the same time, oftentimes we see a sort of claim to data or samples by institutions and saying, they have some sort of ownership interest or right in some instances. At the same time, I think you've clearly indicated that, open data is also important. There are reasons related to the importance of validation in science and of sort of efficiency in science and things like that. But I wonder what you'd say about those who suggest that the people who seek sort of secondary use of data ought to maybe pay something into the system in some way or another. So what are your thoughts on that sort of way of thinking about secondary use and access?
Yeah, thanks for that question. So curating, so the question is whether secondary users should at least pay or contribute to the cost of that data collection, right? I would say yes. Well, it really depends, because so data collection and curation is not free. You need a team of data managers who are skilled. So the training cost is already, the skills and the people skills and resources. You need to have a good software, a good system for security and all that. You need to curate the data set. So collection, curation. You need to make sure your metadata is good. So a data set is useless if you can't describe it, if another person cannot use it without all the supporting documentation. So it's expensive business. To run a data access committee is not free. There's administration costs, there's cost of paperwork, answering queries. And in MORU, that's my job, plus I have an assistant, thank goodness. But we have a data management team that helps with actually sending the data set over. So it's a lot of money to handle these requests. So it's a question of who pays for it, right? Should the people who fund the primary research study pay for it? Or should the people who use the data as a secondary users pay for it? somebody has to pay for it. So I think probably maybe a hybrid system. Maybe the secondary user should contribute to a cost recovery. So not pay for data, but at least help with the administration costs. And I can tell you, we have quite a few requests from people, and after we've given them the data set, a few months later, we asked them, oh, what did you do with them? They said, oh, we've decided not to use them. It's like, what? So there's also, some investment to say that, okay, I'm really interested in this data set and I'm happy to contribute. Because if it's free, then it's going to be not that appreciated. But I'm not suggesting selling data, Joseph.
Yeah, no, I'd be interested to hear if others in the attendees have thoughts on this, and please do share comments and questions in the chat. I see some are coming in, but maybe Sharon, I'll turn it to you and see if you have a quick question before we go back over to the chat.
Yeah, so the questions are coming in fast and furiously now. Well, one of the questions I think relates to some of the work that you do. Is there a data sharing protocol specifically for community-based participatory research? Would there be?
Well, I think every research study, as I mentioned earlier, in the I think it's the Declaration of Helsinki. So what was the question? Is there a protocol, right? The answer is no. There's no one place where you can get protocol, but research collected in any study should be curated and collected with a view of sharing. That will make your research more credible, and you can and other people can use it. So, and any type of research, I would say, of course, if you're conducting research on very sensitive, stigmatizing disease, obviously there has to be additional protections in place, additional anonymization in place. The data access committee reviewing the data access requests probably have to be more careful in making sure that the people who get the data will know how to handle it properly.
Right.
So that's
is there anywhere that people can go to for some of these sort of this sort of guidance, or is that something that you're going to be developing in the future?
That's a very nice question, Sharon. So there are a few things that are happening. One, if you're a researcher with an interest in data sharing and you have questions, you can direct your questions to, as I said, the data sharing working group of the COVID-19 coalition. Maybe you can put the link there, Sharon, or one of us can do that later. Get in touch. There are resources, or there will be resources available there. And also there is a new data sharing course that is in development. At the moment, there are 3 modules already up on the website. There will be more, but those are training courses and where to get help. But if you look at documents, you will find information in various places. Unfortunately, it's not all in one place. So one is the WHO document on public health emergencies. And the other one that came out not too long ago is the RDA. RDA stands for Research Data Alliance. RDA Research Data Alliance. There's a link to a set of documents. And I can put it on the chat later if you don't find it.
Okay, great. Back to you, Joe. I'll just look up the data sharing link and put that on the chat.
Great, thanks. Yeah, so we have another question here asking, what do you think about secondary use of data saved in the data lake? Do you think that users will be aware about the lack of standardization of these data? I'm not sure if there's more to that question here, or if that makes enough sense to you, Phaik Yeong, to be able to respond. But
Can you repeat the question, Joe?
Yeah, it asks, what do you think about secondary use of data saved in a data lake? I assume that's sort of a form of a data repository. And do you think that users will be aware about the lack of standardization of these data?
Yeah, okay. Thank you. Okay, maybe I'll just say a little bit about data standardization. Yeah, it's this is an interesting one because, you know, if data, there are data standards out there, and they're quite disease specific. So your data set, if you're collecting collecting data, you should probably look out for what data standards there are out there specific to your disease. Also look up CDISC. CDISC is a set of standards. That's one of the challenges for data sharing because, you know, data standardization, there are groups working on it. I am not working on that specifically, but there are groups working on it.
Yeah, and just a quick comment and follow up from that. And, you know, it seems to me that especially now during COVID-19, if you look at some of the coalitions, they're actually looking to use data that's already been curated, or as you mentioned, that's been collected in a specific format. And how do researchers and LMICs even begin to know how to manage or curate their data at the point of collection so that it is useful? Or does it then become too difficult for other people to use if it's put in this data lake?
So unfortunately, I'm not a data manager, but you know, hire a good data manager. They will know how to sort it out. But this is a good question. I know many research teams, you know, in LMICs, they do not have a data management team. It's the investigator, the doctor, or the postdoc who was collecting the data. So before you start any data collection exercise, look for the standards, design your CRF, the data collection form, whether it's electronic or whatever, to make sure that you have the data collection tool that is designed well enough to collect the data. You don't want to collect data that is, you know, out of range. You know, it's simple things, checks and balances that you can put in. You also want a good software. Don't put your data on Excel. You want a good software that captures an audit trail. So if somebody changes the data, that is password protected, you know who changed it, when, and for what reason. So that is my advice.
Okay, one last question before I hand it back to Joe is, are these sort of services and, you know, data management expertise and software, are they things that people can or should be putting on their grant proposals, and are funders willing to fund this?
The question is yes. Yes, you should definitely put it on the funding proposal. You know, when I started at MORU, it was 14 years ago. There was one data manager, but no data management team. So we assembled a team. And we bought software. So it is really important to have a good team. And I know in KL, where you are at Sharon, the CRC has a great data management team, and they're very good at it. So perhaps one way is to get them to train the team in your site. That's one way to do it. So as I said, there are various courses available. So the one that I mentioned that's come out recently is for the general audience if you're a researcher. But if you want training on data management, you need to look for specialized data management training courses. And unfortunately, there isn't a degree for data management, so you have to look hard for it.
Great. I think that sort of addresses one of the next questions here in the Q&A about does MORU provide the training framework for data access committees or data management teams? But I don't know if there's anything else you want to say about that now, but other than what you've already said.
So Joe, we don't do training per se, but definitely we can help you if you ask. I mean, I must say we've learned from our experience, so we can share whatever information that we know, but we don't have official training, and that's one of the reasons for the course that I mentioned. So that was developed by myself and 2 colleagues with different experts as authors of different modules, because there is a need for this. So that's why we did it.
Yeah. So we have a couple of questions here about questions about quality of data and data sharing. There's one here about with the open science policy. I'm not sure exactly which country or funder that would be within the context of, but the open science refers to an open science policy and how's it going to impact on the quality of data sharing. And then another comment here in the chat, it's argued that sharing research results, including data, quickly and openly through preprint servers can be at the expense of quality and reproducibility. This is also evidenced by the rising number of retractions of preprints and final versions of paper. Is there a concern of yours and your research community? So maybe if you could speak a little bit towards these kinds of emerging issues and related to policy and practice as it relates to quality of data. That'd be great.
Well, data quality has been one of the problems for data sharing, because what's the point of sharing your data if it's terrible? It's embarrassing, right? So one of the earliest reasons for not sharing is if you ask investigate researchers in a department in HKL, they was like, no way. Because I collected this data, I didn't check it, I haven't, it's data quality. So I can't stress it enough. Data quality is really important. And data quality has to be thought of in the beginning of the process, not at the end, not when the data is collected, in the beginning. So when we're writing our protocol, we have a research question, we collect the data that will answer that research question, and usually people try and collect much more, but it's usually useless. And then we, obviously, when you design the data collection instrument, make sure that a good data manager designs it, have the fields that are appropriate, have the validations in place so that you won't collect data that's, let's say, you can't key in data that's out of range, for example. Because somebody can't be 150 years old, that just means that it's wrong. So the system will tell you it's wrong. So that's data quality. I guess it's the same for preprints. If you have a good data if quality of the data is good, then data underlying preprints should be based on good data quality. Data underlying a press release should be of good quality as well. So that's the fear that we have now during a pandemic. The quality is not good enough. But again, there's a balance between taking ages perfect versus the information out as soon as possible.
Yeah,
so I see there's a question on Google Form. Should I take that? Say again?
There is a question on Google Forms. Would you like to answer that one next?
Yeah, why not?
Sure, go for it.
Well, my personal opinion, don't do it. Well, actually, because we're part of Oxford University here, we are not allowed to use Google Forms full stop. Because it's not secure according to GDPR. So, the UK or the European General Protection Guidelines. So Google Forms is not secure enough for confidential information or information that you don't want anybody to see. It's not good enough. So we are only allowed to use MS Forms, Microsoft Forms. I mean, if it is not sensitive data, by all means. But if if it's sensitive data, I wouldn't use Google Forms.
So I see another question here from Firdaus, and not sure which part of your talk stimulated this question in particular, but maybe it had to do with your response about maybe some should have to pay in or pay for data. But I was also curious about your thoughts. If you could elaborate maybe a little bit more on this. I think you raised it in the early parts of your talk about the potential for inequities in access to data and the like, in light of these kinds of disparities that we know exist between high income and low income countries, and what kinds of measures could be put in place to kind of account for that.
Okay, this is a very difficult one, I think. So in our experience of running at the Data Access Committee, so far we have had one request from low and middle income setting for our data. So MORU has quite a lot of data sets, many of malaria. So they're collected in low income settings. So most of our requests come from high income settings for data collected in low income settings. There's only one from I think it was from Saudi Arabia. So most of so the high income researchers, they have modeling experience, they have statistical knowledge, so they can analyze data really quickly. But I can't say we're an underprivileged group, but I can imagine if you're a group without or researchers with not that not much international funding, you don't want to hand over your data set to a high income setting researcher for free. Okay, and I don't really mean free in terms of monetary free, but I would ask the investigator in a high income setting to collaborate. That's one way of bridging the gap. So if you're a high flying modeler in a high income setting, you want to model using our data, I would like to be a collaborator, and we can have transferred skills. And in return, I'll explain the context which the data was collected and help with the analysis, so we can join analysis, so both parties win. It's not, and we don't want to go back to we want to move from, low income setting researchers are the mere data collectors for the high income setting researchers to do all the brain work. It's not, it shouldn't be like that anymore. And I want to see in a few years' time, someone from Bangladesh and someone from rural Cambodia in a hospital there saying, oh, you guys in Johns Hopkins, you have this data set. Can we have a look and do our own analysis? And that would be great, wouldn't it?
Yeah. Chair, maybe I'll hand back to you. Do you want to do a couple more questions here, and then we'll wrap up?
Okay, thanks, Joe.
Yeah.
So the next question goes back to this idea of the quality of data, especially in relation to the preprints. How regulated in terms of quality should the pre-peer RV platforms, you think, should be to improve the preprint papers, or should not be regulated that much? So how do we get this balance right between regulating the preprints, but at the same time allowing for this data to be released in a timely and efficient manner?
Yeah, well, not sure I know the answer, but the preprints are not peer reviewed. They haven't been peer reviewed, so they're out there for you to look before the peer review paper comes out. The problem with preprints is a lot of journalists and people take preprints as the paper. So there's press releases based on preprints. Press releases shouldn't be based on preprints because they're not peer reviewed. Having said that, the data underlies any publication should be checked thoroughly. So as well as papers, but I would say the data should be as good as it can be, because it's not peer reviewed, it's not checked by a third party. No one should rely clinical decisions based on that paper or that data set unless you are an expert, because it hasn't been peer reviewed, it hasn't been looked at properly. but in light of transparency and quick turnaround, preprints are encouraged, including in terms of in the era of COVID. So I didn't answer the question because preprints have a different reason for being a preprint. Thank you, Sharon, for nodding.
No, that was a great answer. So I think the last question on our end goes back to a little bit, it touches on Firdaus's question and your response to that, in the sense that, have you had any sort of, have you thought about ways in which researchers in high-income countries may be incentivized to actually engage in meaningful collaborations, and what these meaningful collaborations might actually look like, right? So is it just having somebody attend the meetings and listening to a discussion that they may not even be able to understand? And I'm just wondering if that's something you've thought about.
Yeah, well, fair collaborations are very important. In terms of any, well, if you, when you start, well, it should start when you start the study. So designing the questions, designing the protocol, if you can, even at the funding application stage, if that's possible, because you need the LMIC partner to help refine or give you the priority questions to ask if you're conducting that research in the low-income setting. So parachuting research, taking data, not good. So fair collaborations from the beginning, help co-design the questions, co-design the study, co-design the data collection method and approach, and then up to the analysis and writing of the paper. And I want to say a little bit about authorships as well. Very often, the researchers, if you know the ICMJ guidelines, right? They say the author must have taken part meaningfully in the research, design, and analysis, and then for them to become an author. But if you're the one with the funding and you don't make that effort to include your collaborator all the way, then how is he going to be taking part fully in the design and whatever of the study? And they won't qualify as an author as well. So I would say from the beginning up to the end. And then also the researcher from LMIC setting has the context knowledge. It's not that they are free riders. They're never free riders. They do all the hard work on the ground and have all the contextual knowledge.
All right. Well, with that, I think we should thank you again, Phaik Yeong, for this really engaging talk and for joining us in the program, the MORU's program. We thank also everybody, all the participants today, for your participation and for your engaging questions, which we threw at Phaik Yeong in rapid fire, and she did very skillfully, I think, manage that. So thanks again, Phaik Yeong. Our next speaker in the series is Professor Tamara Liskett, who's actually here on the webinar. Hi. And will be joining us April 29th from 9 p.m. US Eastern Time, or April 30th at 9 a.m. Malaysia time. So please join us for the next Hot Topics webinar. Also want to just mention that if you could take a moment after the completion of this webinar, a window will open and will provide you with an opportunity to complete a very brief exit survey. That information that you provide anonymously was really helpful to us in making sure that we keep these webinars interesting and relevant. And so if you could please take just 1 minute to complete that survey, we'd be very grateful. So with that, we'll say farewell for today and thank you again.
Thank you. Bye.
Bye.